How's it going, everybody? Dr. Robert Berghorn here, physical therapist and owner of Ascend Physical Therapy here in Long Island, New York, bringing you another episode of Tactical Tuesday, bringing you the tips, tactics, and tricks that you need in order to not only improve your everyday life, but also your sport performance as well. Everything that we're going to talk about tonight surrounds about a topic that I've been seeing coming up a lot in my clients. I know I have not been on here as frequently as I want to in order to give you your weekly dose of Tactical Tuesday, but I am trying to be a little bit more floating with my schedule so that I'm able to do this a little bit more often and stay consistent with you so that you still get the knowledge that you need in order to better take care of what you need in your everyday life. As far as what we're going to be doing tonight, we're going to be talking about tendinopathy, how it affects you, what is it, and also get into what you can do, which is eccentric training, in order to help mitigate it, help get rid of it, and also help prevent anything happening to any of your muscles or tendons in the future by using that, whether that is in everyday life or whether that is in sport. So what we're going to talk about tonight, or especially right now, is what is tendinopathy. So as far as anything going on tonight, please feel free to comment. Please please share this out so that more people can get on and people can ask questions and people can see this. So I will be able to answer those questions live, but if you don't have a chance to catch this live and see this in the replay, please comment that down still anyway, and I will get back to it as soon as I can, and I will reach out to you personally. So what is tendinopathy? Tendinopathy is anything that surrounds any type of tendon pain. This could be tendinitis. It can be tendinosis. It can be a partial or it could be a partial or a complete tear as well. This is a little bit of a continuum. There are little bits and pieces, but any type of pain or discomfort or issue that involves a tendon is something that is along that umbrella term of tendinopathy. This is something that can be very sharp. It can be painful. Generally in the beginning stages, it's painful right away, or more so basically it can be more painful at the end of activity in the beginning, but as it progresses towards the middle stages, it can be painful at the beginning of activity, loosen up, and then be painful later. And then it can also, once it gets to the later stages, when we start getting into further areas of tendinosis, it can be painful at all times, and limiting your activity significantly. Now, most commonly, this continuum is seen a lot in Achilles tendinitis, but it can be anywhere in your body. It can be in your wrists, your elbows, your shoulders, your hips, your knees. Anywhere that you have a tendon, anywhere that you have a muscle attachment is where you can see this pop up for you, and it is something that can be a big issue. Thank you, Jesus. Thank you for tuning in and watching. Please, if you have any topics that you want me to talk about, please feel free to let me know. Thank you for the comment. As far as tendinopathy, it is something that can be very debilitating for some people. It can be something that is very mild. It can be something that, just keeps you from doing the more intense things. And it is something that does keep people going, but at the same time, people put off getting help and assistance for this because it's just something that they feel like they need to do. Their mother had it, their father had it. They feel like they're getting old. It doesn't have to be a factor of you getting old, and there is things that you can do about it. So some of the other misconceptions that you can hear about tendinopathy is that, you do have to rest it. You can hear this from the doctor. You can hear this from your teammates. You can hear this from your parents, your friends. Just, take a break. Don't stop running. Stop doing your triathlon training. Stop doing your weightlifting. This is something that you can hear all the time from athletes, from your friends to professionals alike. However, for tendons, this is something that is not appropriate, because what happens with tendinopathy, the cells in the tendon itself are disrupted. They're not lined up along the lines that they should in order to attenuate force, as they're pulled and stretched like tendons like to do. They tend, when they heal, especially if you're resting, that the fibers will not align appropriately. They'll be mismatched. They won't have the appropriate strength-tension relationship when you start moving again in order to to move or apply force to them. And that's sometimes where we start getting that scar tissue buildup. We start getting adhesions. And if you've ever seen somebody who has significant Achilles tendonitis, you notice that they have that little bit of a ball at the bottom of their Achilles. Basically, this is all just inflammatory junk, if you want to put it that way. I know that's a very, very inefficient term, but it is something that you can use it to describe, because it's not efficient tissue. It's not something that is strong. It's not something that is appropriate and shouldn't be there. Some other things that you may hear is that you can use body weight strength in order to do it. You can go back to activity right away. Injections are what's going to help it, and that's not necessarily the case. It can help some of the pain go away. Anti-inflammatories can help some of the pain to go away, but this tendon issue exists even when there's no presence of inflammation. That's when tendinosis occurs. Tendinosis is along that continuum of tendinopathy, and it is something that is present when there is lack of blood flow to that tendon. There's scar tissue that builds up, and that's when we start getting that inflammatory process, or that lack of inflammatory process, that lack of healing, and it can be harder for it to heal over time because of that presence. Now, the other side of what we're talking about tonight is eccentric training. Now, eccentric training is basically a movement that we perform in our body every single day. Every joint, every movement that we do has a concentric component and an eccentric component. So using my finger as an example, a concentric component is when we have a, hold on one second. Sorry about that. So basically, a concentric activity or component is when we have a shortening of a body part or motion. So our muscles are shortening in this period. And eccentric is when our muscles are lengthening over time. So basically, this can be when you're doing your squats, when you're bending your knees. That is the eccentric component, because we are bending, we are lengthening the quad muscles as we're going. We're lengthening the glute muscles as we're going down. But as we're forcing ourselves up and as we're pushing up, that's the concentric component. So if you're having, for example, patellar tendonitis or knee pain in the front of the knee, right where the kneecap attaches to the shin, basically what you want to do is you want to slowly and very, not cautiously, but slowly, you want to lower down to the lower component of the motion, and then you want to move faster up. This shouldn't be painful. If it is painful, you go through a shorter range. If it's still painful, it may not be the best exercise for you right now. It is something that you can get back to, and it is something you need to work on, but maybe you need to do instead knee extensions. So sitting at the edge of a chair, or sitting in a knee extension machine and using appropriate resistance that allows you to extend your knee up quickly and then slowly lower back down through accentuating the eccentric component, or the lengthening phase of your motion, so that you're able to help not only align the fibers of the healing tendon, but also increase the proteins that are within that tendon, and also help decrease pain, and also attenuate that tendon to stress like it wants to be. It helps heal the muscle fibers faster. It helps build muscle faster compared to regular exercises. And it also prevents tendon issues from happening again. So if you want to be able to heal this, it is an appropriate way to help improve that. It is a way to not only prevent it from happening again, but also make you even stronger. And this isn't always something that you can do to when you're injured, but it is something that you can do to enhance performance as well. The eccentric component, or the eccentric phase of exercise or activity, is something where we are absorbing force. So anytime that we're taking a step when we're running, anytime we're taking anytime we're kind of doing anything explosive, we do have an absorption component. And by being able to better absorb force and then be able to explode and perform that jump, that run, or any kind of athletic movement, you're better able to prevent any excessive stress to your tendons, and also provide better force for that next step or that next movement that you plan on doing within your sport or activity. And this is not only something that you can do when you're in your performance, but it can also be something that you do in your everyday life as well. Bending down and picking something up, you want to be able to make sure that you do it safely, you do it appropriate, and you have the appropriate form while you do so. Making sure that you're able to bend down and pick things up appropriately, make sure you're getting on and off the toilet appropriately without plopping down, will prevent excessive stress from going through your joints and allow for your muscles and tendons to be able to absorb force appropriately. So I hope that helps, and I hope it helps you better understand what you can do, whether you have tendon pain or any kind of tendon issue, and can give you an opportunity to be able to better fix and address it, while also being able to enhance your performance when you're either in sport or whether you're in your daily activity. If you have any specific questions regarding eccentric training or any specific questions surrounding tendinopathy or any kind of tendon pain, please put them down below. I'd be more than happy to answer them for you directly, whether that is through this medium here, or if you want to call the number that's above there, or also email me directly, or you can reach out to me directly on social media. This is currently being aired on Facebook. It's going to be posted later on Instagram. So if you're catching this on the replay, please feel free to comment. Share this out, because the more people that see this, the more people that this will help. If you have any specific topics you would like me to talk about in the future, please feel free to also let me know. I'd be more than happy to talk about anything that you have going on, and I would be more than happy to assist in any way possible. I hope you guys have a great night, and I will see you guys next Tuesday. Have a great night.